Welcome to this webinar, the third webinar in the phase webinar series on agent-based models in public health. This webinar, which I'll be introducing and then handing over to my colleague Rick Colasanti, who's sat at my right, we're sharing the PC. We're aiming to kind of introduce agent-based models, particularly to people working in public health, either as researchers or public health professionals who don't know much about ABMs, and trying to give some kind of idea about what they are and what their potential kind of applications and why they're so exciting and what potential is. So my name's Lawrence Moore. I'm director of the Social and Public Health Sciences unit here in Glasgow, and I'm lead of the phase network. And I'm not an ABM expert. I've been a population health researcher for many, many years. And it was about 6 or 7 years ago, I first became aware of the potential for simulation-based methods in population health to really be part of our armory in really taking a kind of a complex systems understanding to population health. I was particularly excited about the potential of ABM. So I'm kind of an interested user, and I've been lucky to be in a position of being able to kind of champion or at least to help take forward the use of ABMs in pop health. So I'm going to kick off with a little bit of an introduction as to why I think ABMs might be useful in public health. Well, we have a lot of challenges in the research we do in population health, particularly if we're trying to identify interventions that can improve health. Both the health of individuals, but more particularly the health of populations, and to do so in a way that doesn't increase inequalities in health in populations. And there's a whole set of challenges, some of which I've identified here. We're very much aware there is massive kind of interdependence of a whole set of different factors acting at individual level, at place level, at meso and macro level, and in the relationships between people and the relationships between people and those places and other kind of broader macro factors. So it's really, really complex if you want to fully understand how population health issues are generated and how they might be solved. We also know from the research we've done, where we've sought to identify what interventions might be effective, we've found that it's very difficult to translate evidence from one context to another, and interventions that have been found to be effective in one place have then quite frequently failed to reproduce those same effects in other contexts. And that's because the context is important, and when we use a kind of like a systems framing of that, you know, we understand that systems are different in different places, and actually how interventions generate change is not by working in independence, but by actually contributing to bringing about change in those systems or subsystems. We also know that health inequalities is one of the major issues that most of us work in population health want to address. And really, if we want to do that, we really need to understand how these multiple factors engage interdependently and synergistically to either generate health inequalities, but more particularly how we can change that around and how we can tackle some of these real wicked issues where you have a whole set of factors creating a system which is generating these very poor and inequitable outcomes for people. And then another factor is we know, particularly those working in a more kind of behavioral science, psychology kind of perspective, and thinking about how we change individuals' behavior, there's greater understanding, even for those who principally are looking at the behavior of individuals, recognizing that a huge portion of our behavior as individuals is shaped by the context in which we are at any particular time, through that fast thinking, slow thinking, the Daniel Kahneman work, and really recognizing that where there has been success in bringing about change, it's been through not just deliberative decision making by individuals, but shaping through things like nudge or changing environmental influences on individual behavior. So in research that seeks to kind of understand health and to identify what interventions might be effective, a major tradition has been to identify independent kind of causal effects, to kind of break down our kind of broader kind of understanding of what might be generating outcomes, and actually focusing on sort of relationships between just one or two potential causes and the outcome of interest, and perhaps to do some kind of diagram like this, or a DAG, a directed acyclic diagram, and then to do some analysis which really tries to identify non-confounded causal relationships between one potential causal factor and one potential kind of outcome. That has produced lots of useful kind of understanding, but of course, in much of what we're doing, and when we're thinking more and more about systems approaches to population health, we recognize that that is just a very small part of a much more complex, broader system. And this is the famous kind of obesity diagram from the 2007 Foresight document on obesity, which was one of the first exercises that really kind of identified the complexity and the interdependence of multiple factors as being one of the main ways in which we need to understand what generates and what can potentially be done to mitigate the trend towards increased population levels of obesity. So as soon as we recognise there is this complexity, how do we do that? You know, how do we make this complexity framing kind of actionable and useful for the research we do and the inferences we can take from that research to inform decision makers? And one of the ways I think we can do that is by using some of the ways in which agent-based modelling goes about it. And so I got really excited about this, as I say, about 6 or 7 years ago. And it really appealed to me because it seemed as though agent-based modelling, how it worked, was actually really related quite strongly to what we were trying to do as population health researchers, actually to understand how individuals' decisions are made and how that shapes both their behaviours, but also the state of the system and population kind of health outcomes. So when we talk about agent-based modelling, what do we mean by agents? Well, a precise definition vary, but an agent really is anyone or anything that has some form of agency, and we can understand how these agents might behave in a particular context by understanding and clarifying what the decision rules they might be used to make to change their behavior at any particular point in time. And once we've sort of developed these decision rules, we can then simulate the moment-to-moment existence and any kind of changes in what that agent might do, dependent upon what the context around them is changing, and therefore their behavior changes in relation to that change. And rules can decide, you know, whether the agent moves, whether the agent decides to make a particular kind of behavioral decision, which might involve consuming resources. It might change the way in which the agent relates to the environment and how it communicates with other agents. And these decision rules are governed by parameters, and they then determine about how we model the behavior of the agent, how it changes over time as the agents around it change, or the environment within which the agent finds itself at any one particular time change. And we can simulate this using our agent-based models. We can vary the parameters between different simulation runs. We can make them vary between different agents. We can make them vary between different populations. And so it really does enable us to quite quickly be able to simulate quite complex situations, recognizing that at any one point in time, each agent in the system is still making a fairly simple decision based on these simple decision rules and parameters, but recognizing that this can generate quite kind of complex, complexly variable outputs, both in terms of agent behavior, but more particularly the behavior of the whole population or the broader system. So the kind of agents we might be thinking about might often be people. That's the most obvious thing. It might be individuals, and then the relationships they might have with other agents will be their relationships, such as social networks with friends and family, relationships between colleagues, relationships between students, or it might be between understanding the way in which they might kind of be able to reach, or the strength of interaction with some of these people through their proximity in public transport, through different kinds of relationships. It's not just friendship, it could be power, esteem, other sorts of influence or contagion. And again, these can vary across different subpopulations. It could be that the agents are actually organizations or settings or different types of places, and we can have models where agents are individuals and how they relate to places or organizations or settings or other types of agent. So the kind of thing we can simulate with agent-based model can get quite complex and involve different types of agent and different types of relationship. They're consistent with a complex systems approach. The ABMs allow us to model the detailed interactions between agents and and environments in which they're in, different types of agents such as place and setting. They enable us to explain macro level kind of system properties that arise from individual level decisions made by individual agents in the way I've described through the rules. The way in which we can apply ABMs can be to a whole range of different settings. We can apply it to evidence synthesis to see how different types of evidence can be brought together to understand the behavior of agents in a particular system. And what we can do with our agent-based models is we can sort of actually test out different types of interventions or policy prescriptions by generating predictions of how agents will behave if the context changes. So this really enables us to help us, answer quite interesting and very complex questions, which we can't do with traditional methods of just using observational data or experimental methods. We can ask new and interesting questions about the system. We can understand exactly how the system works and how it might work differently when contexts change or some of these decision rules change. And it really helps us understand and simulate possible future emergent system states. So it enables us to kind of see how the system might change as a result of the cumulative change of behavior of individuals in the system. So there's lots of really exciting, interesting questions we can address with ABMs that we can't do with our standard methods, which are much more suited to answering some of those causal closed questions that I talked about earlier on. So they can help us understand how complex interactive systems can be produced and generate poor health outcomes. We can test out interventions in silico without doing experiments, which is so impossible to do in population health. We can get an idea of what might go wrong. We can get an idea of what particular kind of assumptions or contextual factors need to be in place for an intervention to work. We can identify what might be the key leverage points to target for our interventions, or indeed where the greatest uncertainty lies in our understanding of the system, to identify where we need to kind of collect more data to further improve our models and theories that underpin our agent-based model. So population health research has generally not been very good at simultaneously thinking about how individuals behave and then how that relates to behavior at a population level, either the whole population or groups of people within them. We often have to ignore individual variation to produce strong inferences at population level, or the other way round, where we just focus at individuals, ignoring their kind of place in the wider context. But ABM is such a powerful methodology because it helps us understand what's going on both at individual level, and more importantly about how those changes in individual level behavior can bring about massive changes in system and population level outcomes. There have been lots of applications in public health. There were 2 systematic reviews produced a few years ago, which summed up a number of studies, and there's an increasing tide of studies taking place where ABMs are being applied to population health more generally. A lot of that, of course, in communicable disease, particularly the explosion of ABMs to understand COVID. But just looking at non-communicable diseases, there have been quite a lot of applications, and continuing to discover new examples of that being done. So there is a lot of potential here, and it is beginning to be realised, but I think it is an area where there could be a lot more investment. Here's some very specific examples, and some of these are ones which we've summarised on our web pages. And this is the phase network, and that's the location of the phase website, which I'm sure you'll be familiar with, because you've probably heard about us, and that's why you're here. So that's my introduction. Hopefully that conveys some of my kind of excitement and enthusiasm for ABMs, and for those of you who've not heard much about ABMs before, perhaps that's given you some idea about why they might be an attractive and important additional tool for us to include in our toolkit as population health researchers. I'm now going to hand over to Rick, who's much more of an expert in this than me, and will give us some really, I think, illuminating examples about how ABMs actually work.
Okay, so anyway, as I said, really good talk. And if you have been interested in that and would like to know how to get into agent-based models, that's basically what I'm going to talk about. Where do you go? How do you start? Where do you get this? So I'm going to start off by a quick introduction, a little bit about me, and then the scope of this talk is really about introducing people to ABMs for the first time. And I'm going to look at the foundational ABMs upon which would be really good for you to start at and have a look at and understand how they work. And then we're going to, if we've got time, have a quick look at an actual public health ABM later. So my name is Rick Colasanti. I'm a programmer. I love to write code. And I've really been working on biological models of ABMs. So I've worked on ecosystem models and I've worked on physiological models. I'm part of the FACE group, and if anybody's really interested in doing anything with ABMs and wants more information, contact me via the FACE page, and we'll talk stuff through. I'm really enthusiastic about writing models with ABMs. There's all sorts of exciting things that they can do. So the scope of this talk is really aimed at people who are interested in getting into using ABMs in public health as a way in. Okay, so this is not for people who know how to do agent-based models. It's how do you go in? We've just seen Lawrence's really nice talk, and you're thinking, yep, I'd like to have a go at using ABMs. What's the best place for me to start? We're not going to go through and talk about how to use the actual software. We're going to look at what really good ABM examples that you can learn from and then apply and see how they apply in public health and see how you'll use those yourself. And I'm really coming from this from a viewpoint from outside of public health. And in doing so, I've looked at and I've identified 3 key ABM models that I think would be a really good place for you to go and have a look at. And we're going to have a look at those today. So this is part of this. I did this as part of the case study for FASE. And we looked at a number of models, like Lawrence said. And one of the things we decided to do was, can we identify some of the ABM models out there that are really, really useful? And there's a link down there to see on the side, and that link should be on the web page, on the FASE web page when you look again. And what we've done is we've actually created six models, 3 key models, and then 3 examples. These examples in terms of the public health aren't the cutting edge, but they're a really good place to start. So if you look at those, understand how they work, they'll lead you on to those other ones. Now, this web page actually links, each web page links to a different model. And each web page actually has a model that you can run within it. These are what's known as toy models. So it's nothing like the models we saw Jan use a couple of weeks ago, really complex models. These are toy models in the real phrase that you play with them. Okay, so you're really nice and simple, and you think about them. They're like automated thought experiments. Okay, and one of the nice things about working with ABMs is even if you do a little toy model yourself, just try it. Not for publication, just try and work it out. That you can actually, the actual creation of that model itself makes you think about how the system works. Okay. Right. So just a little plug. All these things are done in web pages. They're all written in JavaScript. I'm a proper geek. I'm such a sad Greek that I actually have a favorite programming language, and that is JavaScript. And I just have a think about using it. It's really nice. You can do some nice visualizations. And as I said, the links are on there. So the first one we're going to look at is Schelling segregation model. This is the granddaddy of them all. This is where it all started. This is where Schelling sat down and was really interested in what's the sociological reasons for discrimination between segregation. How do segregation arise from individual people's acts? And he sat down and thought, well, can I model it? And he modeled it with paper and a dice. Okay, so these are really, really, really simple models. So what are the models? Okay, so we say, right, each of my things we've got here is here's our environment, and you're either a blue person or you're a red person. And if you're a blue person, you're in a grid, and you count the people around the outside of your grid, and you say, how many are like me? And if it's less than a particular percentage I like, then I'll move. I've starred this move here because there's 2 reasons. One, this is a really good example of an ABM where the agents move. But also, the way that I've done it in this model is it just randomly moves. What we could do, it could move to somewhere where it's more happy. So you can see the different methods you can use stuff, and that's something you actually look into. So let's actually have a look at this model. Here we are on the FASE page. And here we go, Schelling model. We'll click on that. And all of these come with a little set of explanations, which you can click on the bottom when you can have a go. It'll tell you more about stuff. But here's our model. So what we're going to do is we're saying, okay, if there's 40% people who are like me around it, then I'm happy. Anything, less than 40%, I'm happy. If there's 40%, if there's sort of 60% of people not like me, then I'll move. So let's run the model. So here you can see that each making little individual reactions. And look, this is the example of emergent behavior. We're getting ghettos, even when it's down as 40%, you're quite happy if, only less than people are like you than not like yourself, and you still get this type of segregation. You can see here in terms of the happiness, not. So let's stop the model. And you can go down and say, okay, I don't care if there's anybody's like me. So just have a randomly done. We can see this, we reset the model. Everything is then random. You've got random numbers next to it. Run it. And of course, everybody's happy, because you don't care what people are like next to you. Stop the model again. This time we're going to say, okay, what if there's like 60% of people, you're sort of like slightly racist society. Reset the model, run it again. What we see again, massive unhappiness. And look at what nice little thing that comes out of this. Look at the areas of segregation. So the blank areas where you've got nobody living there. And we can see here that you get these massive bands turning up. So again, what's nice about this? Really, really nice, really nice, simple model. Very, very, very simple rules. Next model we're going to look at is Axelrod's discrimination. Oh, by the way, I've done a little thing on the papers by the side. Most of these ones, these are models which you really only engage how they work. Very few people actually read the original papers. Certainly the Schelling one, it's quite complex, quite mathematical. But these are well-known models where people have done versions of these in Netlog or stuff out there. And this is really about understanding the model simulation rather than stuff behind it. This one's actually rather good. I rather like Axel paper. And Axelrod, this is a particularly interesting one. What we've got here is about the simulation of culture. And we've got the same setup we've got before. We've got a grid and we've got agents in those particular grids. And the color of those agents, in this case, the agents of squares, the colors of the agents relate to their culture. What does that mean? Well, we give each agent 6 numbers in a list. And then it looks around its local neighbors. In the Schelling one, we look around its 8 neighbors. Here we only look around the 4. And it says, okay, what's my percentage chance of me interacting with those people? And the chance of you interacting with those people depends on how many numbers in exactly the right place are the same. Okay, so this is thinking like, what are those numbers? You can think of those particular ideas. Okay, we've got Rich in the room here. I know he's a cyclist. So, Rich and I have a cycling link here in terms of 5 and 6. And also number 6 likes to go on foreign holidays, might like going that. So we might interact. And if we interact together, then he might pass on one of his sort of interests in me, which is like population science. And therefore, I change from being a 7 on population science to being a 4 on population science. Therefore, our sort of culture has become the same. And that's it. So on this one, the agents don't move, they change their state. And again, really nice simple model. So let's go to the phase site again. Let's go down to discrimination of culture. And let's run our model. So here we can see we've got a measure of similarity, how similar people are in this environment. This environment, we've only got a 10 by 10 environment. And our blue thing is the number of cultures. And what you'll see here is, look, and then we can also view here if views show similarity. You've got, this shows you how similar stuff are. So the more green it is and the more greeny blob you've got, the more similar your system is. So let's go back to looking at the numbers. So therefore, look, we can start seeing little patches of numbers coming up. Now, all this is done randomly. Now, watch this, is really nice. Look how quickly this system's suddenly dropping off. Very quickly in our small little environment, we can see that the number of cultures, the number of different types of people is really dropping off and quite quickly. Yeah, and we can see the sort of drop off in systems like this. So let's stop that one. So here in our little system, look, we've got lots of, very many people have got very similar behavior. Okay, so let's look at different. Let's look at a much bigger environment. Let's look at a 30 by 30 environment. So let's reset that again. And here The lines are smoother because I've got more individuals in there. So we're sort of doing more numbers, but it's sort of behaving slightly differently. It's sort of becoming more asymptotic. It's like slowing down over time. You don't see that sudden drop off. Now, one of the things I think you might think is, oh, is that just a fraction of it being a bigger number, that it will just go down slowly? Well, in preparing this talk just now, I thought, some people might actually think about that. And so I ran a little experiment this morning. So this is the way you do this. You try that out things ago. So if we stop this one now, go back to. So as they say in the old-fashioned Blue Peter, here's one I prepared earlier. And I ran this, look, I ran it for 12,000 iterations. And it became asymptotic. So look, we've got some really nice little things. We've got a bigger environment. So we've got more cultures in them, and they're more groups together. Now, whether that's true or not, or whether it's not, that's not really the point. You've had to think about this, and it's made you think about these things. And the reason why this one's important is, again, because one of the things you might do in your sociological ABMs is you're going to look at transfer of information between people. Now, here we just did it on a 4x4 grid. You think, oh, well, how does that change if we change the network it's on? And the reason for that, and we're now going to our third major model, which is the small world model by Watson and Strogatz. This is actually part of, for those of you who remember, explains the 6 degrees of separation model. So there was a famous study done by experiment done by Stanley Ingram back in the 60s. And what he did is he had, I think, about 40 or 50 random letters he gave out to random people, and the addresses on those letters were to other random people that they didn't know. And the rule was, pass it on to somebody who you might think might be nearer this person where they're trying to get to. And he ran this model, and surprisingly, a large number of letters actually got there. And the sort of number of links it took to get across America was only 6. This was known as the small or 6 degrees of separation model. And the way that it works is this. Well, if our links to everybody were just regular, then all you could do is pass it to your neighbor, and hopefully it would move slowly over time across the environment until it got to the part of America you wanted to go. But it can't be entirely random, because you could just be friends with sort of a computer scientist in China or a nurse in Australia. And so it can't be a random collection. So what they thought was, it's more likely that you've got a lot of local connections and then the occasional long distance connection. And it's all about how these connections in your environment change the behavior of the system. So what I've done here is I've done, again, a nice, really, really nice toy model using COVID, as we all know, looking at an infection model. So what I've got is an agent, and it's surrounded by 8 other agents, and there's a probability that they will infect them. And that's when you've got just a local link. And then I can do the occasional long distance link, which is linked here. We see how that difference makes. So again, let's look at the model. Let's go back to the page, scroll down here. Here's the infections on a small world. Click on this one. And what we've got here is, I'm just setting up normally, we've got a sort of 40x40 grid, and we've just got local connections. So that's right. And what you see here, so we've got 3 colors. You've got the standard SRI model, you've got susceptible, infected, and recovered. And here I've got a quite high R number of R6, and so we can see it suddenly bursting through everybody and it petering out. Okay, so we get to a maximum of about, I don't know, 500-600, certainly below 1,000 at that time scale. And that's, so what happens, so if we keep everything the same, all we do this time, stop the model, and we're just going to add a few random connections. So let's reset. The random connections you see here are sort of blue lines linking between models. So we've got a central one, and they could possibly be this one. Run this time. Now let's see what grows in the same way. But now we start to see secondary connections come up. So look, much higher rate of increase, also gets to just about 1,000. So many more people at a particular time. And now look, what we see here, just by adding those connections, we now get the behavior of the system behaving completely differently. We're now getting waves in the type of numbers that react and behavior, the type of thing that we're seeing in COVID at the moment. Now, does this completely model COVID? No. But again, it's this idea of there's a model, we've got agents interacting with each other. We make connections between the agents. Again, really, really nice, simple model. And yet we get some interesting behavior about it. We start thinking, where can we actually take this? So Most ABM models that we use in social science, and certainly ones I've been looking in public health, are variations on this theme. So if you're really interested about wanting to get into agent-based modeling, these would be really good places to go and start. Look at these models. There's plenty of them out there in various programming languages. It's got some nice versions on that logo. You go and have a look at them, and that's a good place to start. My usual feeling about programming is that there is no right or wrong way to write some code. And as long as you know how it runs, as long as you run in the way that you think it does, and you understand it and can pass it on from somebody, then that's all you really need to do to get started. And you really want to just get in and start playing. My only advice I would give to everybody, and it's entirely, certainly suggestion only, is that when you start writing models, keep them nice and simple and nice and small to start with, so that you know how each bit is going. It's, when you're looking at some of the more advanced agent-based models out there, there's some large parameters and stuff. Work it back until you can, understand how the individuals work. Right. So we've seen the three types. We've got the shelling model, which is looking at agents that are moving about, and based upon what they see of their local environment. We've got the Axelrod model, which is looking at how individual agents interact with each other and how they would change their state based upon those. We've got this one, which is a nice small world model, which basically says, okay, what we're interested in is how those agents are linked up. Let's look at one of the models that we've actually sort of played with. And this is a really good one. I'm really impressed with this one. So this is by Alkengloss. This is a relatively new model. And what's really nice this, and I really advise you to go and have a look at this one, is she's done two papers. One which she's actually looked at how segregation relates to diet and public health. Done that as a straight model. But she's done this paper, which is terrific, which is a brief introductory guide to agent-based modeling and an illustration from urban health research. She goes through and basically takes her model and explains how she's done it in that context and talks you through it. Really, really good place to start. So what I've done is I've taken her model and make it even simpler. Okay, and I rather like this, and it shows off the type of things that agent models can do. So let's go. It's down here. I'll just show the other ones we've got as well. So we've got this one, which is looking at where shops move in terms of segregation. I've got one here, which is looking at obesity epidemic, original model done by Barr, which is a nice one to go have a look at. And the final one here is a drinking behaviour one done in Gorman, which is basically looking at how people influence each other. But the one I want to show today is this. So let's look at it. So what have we got here? What are we looking at? So we've got agents, and there are two types. So I can see in the background, there's sort of light and colour. Let me just do this just quickly, and I'll show you again. So anything that's got a dark background behind it is a high-end agent. And anything that's got a light coloured behind it is a low-end agent. Okay, so that's it. So you just so when we set the system up initially, we just randomly allocate each agent what social class it's part of. Now, what we've then got in these circles are shops. And the shops are of two types. You've got high-end shops, which are blue, and you've got convenience shops, which are this sort of red colour. Now, the colour of the dots in between shows you where the agents are shopping. And the simple rule for determining which agent is shopping at which shop is how close is it to it. So in this one here, so you can see the sort of boundary which is closest to which. And the colour indicates which shop it's doing. So initially, we have two rules which we add onto this model, two really simple rules. First rule is higher end agents spend more in higher end shops. That's it. They spend the same amount of money in the convenience store, and the lower end agents spend the same amount of money in both the high end store and the low end store. So that's the only difference I've done on this. This is slightly different in the Alkengloss model, but her model's more complex, and I just wanted to make a nice simple one to put on the webpage. And the other rule is all the shops have a certain profit at the end of an iteration, and the one that's got the least profit goes out of business, and then a new shop randomly appears somewhere in the system of a particular type. So let's run the model, nice and simple. And here you can see we get areas where we've got particular shops, and you can see the shop moving and trying to find an area where it can gain custom. And one of the things you notice quite quickly if you run this. Now, one of the things about agent-based models is they don't always run the way you want them to. Luckily, all the ones I've done beforehand, I had the speech lined up for when one of the ones I didn't do what I wanted it to do, but they're all behaving rather well at the moment, so I'm rather pleased with that. But what you can see here is we've got actually more high-end shops in a mixed environment than we have convenience stores. And when you sort of think about that, I think, yeah, because all I'm doing, this really simple model is who's nearest, I'll take what I can get. And the high-end stores can make more money because they're taking the high-end people. Okay, so it swaps about. So that's nice. We kind of see that. What's nice is we have to look at segregation. So it's in a segregation model we're doing. We're saying, right, okay, we're going to split the environment into two. The top end is going to be for the higher end agents. The bottom is going to be for the lower end agents. Again, we start off with randomly dispersed shops of equal type. So we've got 4 high-end shops and 4 convenience stores. Now let's run the model. See the stuff moving about and going into areas territory. And what we see really quickly turning up, which is really nice, is 2 things. One, your high-end stores are automatically moving to just on the pure thing of into the higher end areas. And in the low end area, not only have we got fewer stores, but they are of the convenience type. And look, we're getting the occurrence. I think we could say you've also got food deserts at the bottom because you've got fewer stores that are coming out of there. So is this an exact model of how shops move in real-time environments? No, they're not. But it's a nice little thought experiment for you actually to do. So anyway, I hope this has been a really nice introduction in terms of the type of places you can go. Remember, all of this stuff is available. So not only have we recorded this, so you can see it all again, but we've also, all these models are available on the website, and you should click on them and have a look. Also, getting back in contact with me and talk about anything else. So, final thing, of course, is thank you for some acknowledgements. Thank you. Very, very big thanks to Alice, who has, been really helpful in putting these models together and me be able to write them, and all the text that makes sense is down to her. Again, Lawrence, Rich, Alison, and Eric, who've been really supportive with creating both these things and encouraging that. So, final thing, I think we can both do it on this one. Have we got any questions?
Yeah, so thanks very much, Rick. That was great.
I'll let Lou.
What we can do in this platform, we can take any questions either through Q&A or chat. I think it's might as well do it through chat, because then everyone can see the questions. So if you've got a question, please do pop it into the chat. So one question, from Maysoon, has ABM been used in studies looking at the health system functions and health systems performance?
Yeah. There's quite a few out there. There's been things in terms of both in terms, again, like the shopping model. You've got where you put various health services and stuff like that. A lot being used in terms of ambulance work as well. There's been a fair bit done in terms of the spatial distribution of where things are in hospitals. If that's the question you want.
Yeah, thanks. I think I'm not certain. I can't cite you, Mason, any specific examples of health systems ABMs. I know, there clearly are groups who are using operational research methods to model health systems performance. Particularly, there's a group in Cardiff I'm familiar with. I know that they have used ABMs in some of their work that I've discussed with them, but what case studies there are that have been published of ABMs as opposed to other kind of simulation approaches and systems dynamic models, I'm not certain. But I mean, you can understand from hopefully the examples we've shown you today how powerful ABMs are in just kind of really understanding some fairly simple decision rules about individual behavior can lead to some quite dramatic kind of alternative system states, or in the case of health systems, it might lead to some kind of health systems working very efficiently or inefficiently, and feedbacks from that further determining individuals' behavior. So I can't cite any examples, but I'm sure that is going on in terms of ABMs. So Rich, second question from Rich. Can ABMs be used to predict the future?
I predicted he was going to answer that. Thank you very much. Anyway, here are we, try the vegetarian view. Yeah, no, yes and no is the answer to that. So the no question is they can't be used to exactly predict what's going to happen because most ABMs are probabilistic. So you're looking at a range of things. So you wouldn't use one model to predict one thing. You could run up a range of simulations and various things that would give you a probability that something was going to happen. I think that's a reasonable, a sort of academic answer to it. Will it predict the future? Again, it's going to depend on the questions that you actually answer them. The yes bit is yes. If you're looking at a tightly determined ABM agents where you've got them in a tightly informed environment, they will tend. So if you're looking, so one example that they use is ABMs for looking at how you vacate a building in terms of an emergency. And they're very, very good at that. So yeah, it depends what questions you're asking. If you're sort of saying, what state will the health service be in 10 years' time? We don't know that. So they're very similar to all types of models.
Yeah, I think if I can have a go at answering that tricky question, I think potentially yes would be my answer, but that probably reflects my willingness to be quite fuzzy in my thinking. I think what ABMs certainly have a lot of potential to do is help us kind of understand future scenarios and give us a better idea about how things might develop in future based on our understanding of how a particular system is working and how the kinds of interventions and different policies we might want to be looking at and what kind of future outcomes they might generate can be really kind of helped by that. I mean, what I kind of feel, which I kind of didn't put forward so well in what I said, but it certainly kept coming up in what Rick was saying, is that in a sense what an ABM does is help us really kind of think about what our assumptions are, what our theories are about how an individual will behave within any particular kind of situation based on the decision rules which principally relate to their relationships to other agents around them or the kind of environments and contexts in which they're in. So it's enabling us to kind of encode a theory and through the simulations to really kind of test out and understand how variations in that in individual behavior and the kind of like the rules we're saying individuals will follow can then produce really quite outstandingly different kind of outcomes in terms of the wider state of the system or the wider kind of population health outcomes. And in a sense, that ability of ABMs to do that is to help us kind of encode a theory so it's very explicit, and then to see under different kind of scenarios in terms of changing those assumptions or changing the starting points and other aspects in relation to the context can then enable us to see what happens, what the outcomes might be. So in a sense, that is predicting the future, albeit in a very kind of fuzzy, loose way. I think if we get, what there are a few examples of at the moment is where you've got a fully parameterized, fully validated model where you've got an ABM that's been developed about your understanding of individual behavior, then developing understanding on how that leads to different kind of macro outcomes. If we could then validate that fully against a very kind of comprehensive data set, that would give us sufficient confidence that our ABM was actually reflecting reality. And therefore, one way in which you would judge the value of that model is its ability to predict, short-term and longer-term futures. I think there's not many examples where our ABMs are sort of sufficiently well developed and sufficiently well calibrated for us to pretend they are prediction models, albeit, as I say, I think in very loose, fuzzy, kind of more theoretical terms, it helps us with our scenario planning in a very useful way. So that would be any other questions from folks?
Any real ABM models out?
Sorry, that Alice, you said there's a hand up. I can't.
Yeah, we can't see people.
I can't see.
Okay, yeah, Grace has got a hand up. So Grace, if you want to just ask your question now, you should be unmuted.
Sorry, that was an accidental hand.
Thank you.
Oh, that's a hard one.
Thank you. Well, I think we if there's no further questions, we may as well conclude. Hopefully this has been useful. I mean, clearly Rick has gone through quite quickly some of the examples he's developed, and I think the 6 examples on the website are a really nice, accessible way for people to just kind of understand how, formulating some fairly kind of simple scenarios based on, agents' decision-making rules can then lead to these very dramatically different kind of outcomes. And I think that's one of the most exciting things that ABMs deliver, is just helping people to understand that just sort of small changes in any one individual's behavior, when they accumulate over a whole population, can produce absolutely dramatically different kind of system outcomes. And I think this is something a lot of us working in population health have known kind of instinctively, that some of the most powerful ways in which we can bring about change in population health is through interventions that only bring about small, negligible, often invisible changes in the behavior of any one individual, but nevertheless do accumulate into the most important kind of population health outcomes. So that's, for me, one of the most exciting things about ABM. It helps us to demonstrate that, and it helps us to understand that. And I think the examples that Rick has got on the website, and with obviously full links to the full references, hopefully a useful resource for you, but also to others that you might be working with, who again are people who don't know a lot about ABMs, but might be kind of interested and intrigued in terms of what they are and what the kind of things they can do. So question from Serge: what would be the interests of the use of ABM for policymakers that are not expert in health issues? Just trying to unpick that question a little bit, Serge. I think one of the areas in which ABMs can be really useful, and actually a lot of the applications that we're working on in the unit here, are where we're working with people who perhaps don't have a direct responsibility for health. Maybe they're more responsible for transport or for planning. And I think what an ABM can do is it can demonstrate how some of the things they're responsible for, small, important changes to a local environment. I mean, the example that Rick talked through in terms of the shops and the kind of like the different kind of social segregation of people, and how that then related to their behavior, but through the ABM demonstrated that can be you can then understand using an ABM how that can generate quite differential accessibility to food. Food deserts is something that's been talked about and written about a lot, and research has been kind of a little bit inconclusive on that, because there's been different findings from different studies, but actually the ABM there really helps you understand what's going on. And so I think people with a responsibility for planning can then use an ABM to really kind of potentially understand how the decision they're making might then generate these kind of quite substantial kind of social gradients in terms of access to healthy food, something like that. So I don't know if that fully answers your question, but I think this is one of the things we're aware of in population health, that some of the kind of key levers that influence population health exist in departments where they don't have an explicit oversight of or responsibility for health. But ABMs like this can demonstrate some of the health outcomes that are generated from changes to the environment or or maybe changes in which we incentivize or resource individuals to behave in environments to bring about kind of quite big health impacts, and particularly inequalities in health impacts. And then follow-up question from Serge as well: how to involve policymakers or citizens in the design of ABM, participatory ABM models? Well, that's a great question. I mean,
yeah, I mean, sort of bang on about sort of achieving society stuff again, but that's why I do my stuff in JavaScript, is because we can actually run the models within web pages, so they don't have to install any specialist software, and they can sort of run scenarios. There's also another interesting thing which you can do is actually get people to act out scenarios using sort of like web-based games that you can then use to inform the agent-based models. Is another way forward. But the main thing is, can people actually play with them in the same way that I was playing with the models there? Can they change the parameters? Can they get a feel of how they can do it? Can they do it in a nice simple way that doesn't involve them installing large amounts of software? I think that's the way to get people involved, and also have good graphics. At the end of the day, you want to sort of want to see what the things are going, so you can got some visual feedback as well as data feedback.
Yeah, and there's and there's different projects we're working on here in the unit. We're certainly involving policymakers, other decision makers, and in some examples involving kind of public representatives in helping us understand the system we're trying to model and understand the ways in which people behave in that system. I haven't been directly involved in a lot of that, but certainly I was involved in some meetings we had about work we're doing on social care that Eric Silverman has been leading, and we were speaking with some of the people working in Scottish Government, and they were thinking through the different kind of policy scenarios they were facing, and they could really see in the work we've done and the potential work we could develop in the future how some of the issues they're kind of wanting to think about can really be helped by using an ABM. And one of the things we haven't kind of highlighted, I think, in the talk today is that the ABMs can often really help identify kind of unanticipated outcomes, because you can model, through a fairly kind of simple set of individual decision rules. You can run the model and you can see, well, yeah, maybe the thing you were hoping to happen does happen, but a lot of other things happen as well. Because of a long running the model for a bit longer and seeing how the kind of this kind of feedback from the system as the system maybe changes in an emergent way. Or potentially quite quickly, you can be monitoring a particular metric and seeing that metric is changing in a way that you didn't expect. And for example, in the social care work that Eric did, he found that changing retirement age in a way that was designed to reduce the funds required from government to support pensions, so it was intended to kind of reduce demands on the state to support families by increasing retirement age. Actually, the rebound effect of that on the availability of families to provide informal social care to older people actually meant that the cost of the exchequer went up. So reducing retirement age under the assumptions of that model, and with a fairly set of decision rules and an understanding of the family composition across the UK, it actually led to a higher burden because there was a greater need for social care to be provided by the state, because the availability of 64-year-olds to provide that care had disappeared because retirement age had gone up. So that was quite interesting. And so discussing it with them and discussing how they understand people act and what they expect to happen, and then actually demonstrating what does happen as a result of applying those rules to their decisions that can often produce things they weren't expecting, which helps them then redesign their policies.
Well, you've worked with pitching to people. How have you found their acceptance of it when you go and talk to actual policy people?
Yes, well, I think what we find in our work, I think there's been a big disjuncture between a lot of the way in which we've traditionally done population health research, which is to focus on identifying with great certainty causal relationships between one input and one output. Actually, most people working in the real world, in whether as a policymaker or in the commercial sector as well, I think this would be the case too. Actually, they understand the world is a complex place, and understanding something with great certainty, but is only a very kind of small part of what's going on, is less useful than getting a broader picture of the interdependence of all these different things. And so I think having simulation modeling and now allowing scenario planning to take place, even though it's not giving you perfect predictions, but it's giving you a real understanding of what's going on and what kind of different kind of types of outcome might be achieved through different actions is really valued, and it's the kind of evidence that decision makers need now, because they're increasing understanding that they're looking at trying to manage very kind of complex situations.
Just one last thing before we go. One thing I forgot to mention. If you are interested in doing the stuff with the ABMs, and that's have piqued your interest, in the Schelling model, which is a really good place to start, I've also put 2 links to the Schelling model that's done in that logo, and I've also written another version in Python, which runs under a thing called Cobab. So if you're interested and want somewhere to start, you've got 2 codes to go there, and I forgot to mention.
Okay, great. Thanks, Rick, and thank you all for your attention, and then some really good questions. So thank you for that. I hope we answered them reasonably well. So thank you for your time, and thank you for a little bit of applause filtering on the screen. So thank you for that, and take care, yeah, everyone.